Hey, good people. This week we are going to be talking about working with our adult population and getting into some specific issues as it pertains to our aging or the gerontological social workers, and some of the issues that may come up specifically for our older adults. But right now we're just going to begin at the beginning of the chapter where we begin talking about bereavement counseling. Bereavement counseling and working with adults, as well as with any young people or young person, I should say, there is one specific element that we have to be mindful of when we're talking about bereavement counseling. And that element is that every single person grieves independently of for themselves and what their memory was, what the relationship was with the person who has passed away. So we cannot put people in a box when it comes down to providing bereavement counseling. However, our book references a very specific theorist that talks about bereavement counseling and 5 stages of bereavement that we may go through, Elizabeth Kubler-Ross. Now, there's just brief mention of her in our textbook. However, as you continue on in your studies, should you take an introduction to psychology, general psychology course, or an upper level psychology course, you may come in with more information in regards to Kubler-Ross and her theory on the emotions that we go through when we're talking about bereavement and working in the area of grief. Let me just mention real quick when we're talking about the areas of grief that Elizabeth Kubler-Ross had talked about. She said those 5 areas that we look at are denial, bargaining, anger, depression, and acceptance. Now, all of these emotions kind of tie into some of the things that we need to look at specifically when we're working with our older population. And some of the first place where we start out is going to be with our physical and psychological effects of going through a time of bereavement or grieving. So as you see here on our slide, we have issues related to sociocultural influences as well as situational influences. Both of these types of influences, we have to be mindful of one big thing, and that is that when we're going through these issues, and as people are experiencing these moments and these stages of grief, there's 3 specific contexts of bereavement that we want to be mindful of that people may experience, especially if we're talking about the loss of a spouse. The first one is that intrapersonal emotions. Then we have interpersonal emotions, and then we have our community or our social support system. All of these things kind of tying together when we're talking about working with the whole person. So let's be mindful that we're looking at our sociocultural influences, situational influences, but most importantly, how is it impacting the person whom you're providing services for? As we move on, still talking about working with adults, we get to, again, just very brief section in our textbook where we are exploring the position of an EAP social worker, an employee assistance program social worker. And an employee assistance program is basically a workplace crisis intervention sort of counseling service that is provided. Usually, your EAP workers are licensed social workers, and they provide a number of different services, and they function in several different roles within the workplace itself, the workplace environment. They provide advocacy for employees. They provide resources and referrals for employees. They also provide, again, just short-term counseling intervention. And again, that's just a very brief introduction to EAP workers. Again, that's a position usually that is held by someone who has a master's degree and also is a licensed social worker or licensed counseling professional. We then get into a couple of other different areas that I'm just going to briefly mention. And those areas that we look at are going to be areas pertaining to our veterans administrations, our VA, our returning veterans. We also have in talking about services for our veterans and our returning military, we know that there has been an increase in the need of mental health professionals in this area, just for the mere fact of providing some type of assistance for our military staff to transition from military life into, again, civilian life. So there are a lot of areas that, as a social worker, as a counseling professional, where you would see your services be used. Now, again, when we're talking about working with within the VA, working with our military, working with actually even within civilian agencies or organizations. Please, good people, don't get blindsided by the title of the position that folks may be trying to fulfill. Always be mindful of the skills that you have and how you can meet the demand or meet the responsibility of the position that they are looking to fill. So again, we're talking about working with our military, some of the work that you would do as a helping professional, as a social worker, as a beginning clinician, would be to provide assessments of the family, to look at resource and referrals throughout the community, to provide some type of treatment or goal plan for someone who may be transitioning, again, from military life to civilian life. You may be the advocate for that military person and that family member, and trying to get them the services that they need. When we're talking about looking at, oh, I'm going ahead too fast, I'm sorry, y'all. When we're talking about looking at being an advocate for our veterans, as well as for those who are not within the military, it is very, very important, good people, that we know the power that comes in being the voice of our client, consumer, or patient. So we always want to make sure that we are knowledgeable of, again, what the need may be, and also what the services that currently exist and the services that are needed. Okay, as we go on and talking about services for our adults, this is where we're going to kind of get into looking at working with our aging population. We know that we be hearing in the news a lot, I should say, information about our baby boomers and the growing baby boomer population. We are getting to a place where, yes, we are seeing an increase in our aging population. And so we have to ask ourselves, culturally, socially, are we ready for the changes that come into play when we're looking at our growing aging population? So some of the things that we have to look at are going to be the assistance that folks may need. Coming from family members, coming from friends, coming from our community. Remember our circle of trust. So who is in that circle of trust that can help provide some assistance when it's needed? When we're looking at financially, where are we, first of all, in providing the necessary services, but then also where are we in looking at providing some assistance to those families who may be in need of some type of financial assistance or financial exception when providing care for the aging population or an aging parent. We also have to look at, again, the circumstances around why we are providing, or how we're providing care for our aging population. One of the things that's mentioned in our textbook is this whole concept of kin keepers. And when we talk about kin keepers, we're looking at, the family members being the ones who are providing the care for our growing aging population. And who is doing that? And what type of services are we making available for that person that's providing the care? The services of emotional support, physical support. How are we providing that? We meaning society as a whole, our service industry. How are we providing those supports for people in that position? When we're talking about providing care for our growing aging population, we also have to be mindful of our LGBT population. And there is something that's very relevant when we bring out this segment of our population, knowing that, yes, we still see the same situations and same areas of concern in the LGBT community as we see excuse me, in a heterosexual family or heterosexual aging parent. However, there are some very significant differences. And some of the differences that we know are going to be the increased concern about um, having the respect, I guess you could say, of being the caretaker, the concern about having the access and the opportunity to obtain resources for your partner. So in our book, there is a very specific statement that's in here that's really, really relevant, and just one that we have to be mindful of. And it's actually the last sentence in this paragraph, and it states, conclusions indicate a need for resources and programs that address concerns of the LGBT community and systems of support that specifically meet the needs of LGBT caregivers. We have to know that that segment of the population is one that needs to have additional services, needs to have additional advocacy services in order to ensure that there is an equity of resources available, and not an exclusion or not hindrances and barriers to partners within the LGBT community receiving and accessing those services. Okay, as we go on, we get into an issue again as we're dealing with our growing aging population of dementia and Alzheimer's disease. Uh, when we talk about dementia, uh, we know that dementia and Alzheimer's, uh, this is an area. Let me go back. Dementia is an aspect associated with Alzheimer's, and Alzheimer's disease we know is this progressive change in our mental abilities, in our functionings, our physical functionings, and also in the way that we're able to communicate and socialize. So it's a progressive disease that for some it comes across slowly, for others it could be a quick impact. There are some very specific issues that family members have to address when they're caring for their loved one who may be diagnosed with dementia or Alzheimer's disease. I included in this week's folder a video that is entitled, Grandpa, Do You Know Who I Am? And this is a video that is narrated by Maria Shriver, and it's all in regards to how children uh, view their perspective of viewing and being a caretaker or an integral part of the care plan for their elderly family member who is diagnosed with dementia or Alzheimer's. It is, yes, um, a very emotional video. But I'm asking that you watch the video with the eyes of a helping professional, excuse me, and kind of void the emotion as much as possible, but view that video with the mindset of what changes could be made, what changes need to be made, what services can be added when we're talking about how we work with our clients, consumers, or patients who may be diagnosed with dementia and Alzheimer's, as well as how we work with their family members. Because one of the things that we get to when we talk about working with our growing aging population is the whole idea and the concept of support for the family members who are functioning as the caregivers, the support services within the community, within their circle of trust, the support services in general overall that people can tap into when we're talking about being a caregiver for that older generation. Again, these are things that as a helping professional, I just want you to have your eyes open when you begin to watch the video, but also think about relationships maybe that you're familiar with. Think about situations that you may be knowledgeable of in regards to um, assistance that may be needed or that could be beneficial for someone who is being a caretaker for an elderly loved one. and what kind of changes could be made? How could you advocate for those changes? How could you provide the services for that loved one, or at least provide the referral for that loved one? Who could you contact? So again, just things to think about as you're watching the video and in reading through the beginning part of this chapter. Now, as we go on through this chapter, we get into the discussion of intimate partner violence. Intimate partner violence, this is a very, very significant problem within a family system, and not one that is just prescribed to our aging population. So I don't want you to get that confused. When we talk about intimate partner violence, we are looking at violence that, or issues that can be either physical, it can be sexual, it can be psychological, emotional, the behavior of one partner towards another, that is creating this sense of intimidation, of fear, of creating a violent type of relationship. So when we think about intimate partner violence, the way that our book kind of gives us this information, and how I want you to kind of proceed in thinking about this, would be to look at this as a public health issue. How do we prepare, and how do we empower and educate our communities about intimate partner violence? How do we do, and we have to think about the members of our community, not just our dating couples, but how do we go back maybe even with elementary school? How do we do it in with our growing aging population? Because when we talk about, again, this intimate partner violence, there are a lot of different areas that we have to address. But our book kind of breaks things down and just gives us our four basic types of behavior or violent tendencies that are included in the concept and the issue of intimate partner violence. We have physical violence, sexual violence, stalking, and psychological aggression. And this is all kind of spelled out for you in the chapter, giving you a little bit more information about what you're looking at. When we talk about the intimate partner violence, again, we are looking at who the population is that is most dominantly impacted by this act. And while, yes, we know that a large percentage, I should say, of victims tend to be female, we cannot exclude that men can also be victims of intimate partner violence. Let's not forget that. However, for this section in our textbook, we're focusing on women as the victims, and men kind of as the perpetrators. But again, we have to be mindful, good people, that script can be flipped, that men can be the victims and women can be the perpetrators. And we also have to be mindful that this is not subject just to a heterosexual relationship. Yes, it goes into our same-sex relationships. So this is kind of comes in layers, and we just have to be prepared in how we address this. But although the victim and the alleged perpetrator, of course, we'll say is there, we can have no specific gender, or either gender participating in or functioning in that role. Sorry, my words are getting confused. One thing we have to be knowledgeable of is that there's three phases that we kind of see as a helping professional, and where we begin our work and working with the victim of intimate partner violence. And the three phases that we see that, again, begin to demonstrate this issue of control, because that's what abuse is. Abuse is all about control. And the three phases are the rising tensions, the violence, and then, of course, we get into this loving contrition, the honeymoon period, where things are going to get better. I promise I'll never do it again. We have to be knowledgeable about these different phases that people may experience, and how are we going to be preparing our client, consumer, or patient to work through this. So again, when we're looking at this this issue of intimate partner violence, we have to think about the services that are being provided to folks. And when we think about the services being provided, um, the whole idea behind working as a team, a multidisciplinary team, is to make sure that we are, first of all, embracing the victim, that we are empowering the victim, and that this person begins to feel as though they have the opportunity to regain control over their lives. Okay, so we have a team approach, a multidisciplinary team approach, or a multidimensional approach. We have, again, the services, we have crisis intervention, we have emergency shelters, we have transitional housing, we have legal advocacy, we have therapeutic intervention or counseling. Again, all of these tying in together with the goal of being to empower, to reinstate, to build up the feeling of self-actualization for the victim, that they can then begin to take control, regain control of their lives. Now, as we move on throughout this chapter, this is where the book kind of breaks things down a little bit, and we begin looking at elder abuse, as well as, I believe we get into a little bit of child abuse in this chapter. When we're talking about elder abuse, actually, no, I don't think we get into child abuse in this chapter. I'm sorry. When we talk about elder abuse is definitely one that is recognized as I'm sorry, as a is recognized legislatively, and also it is recognized as um, part of your responsibility as a mandated reporter. So when we think about being a mandated reporter, it is not just reserved for suspicions of child abuse, but also with elder abuse, as well as intimate partner violence. When we get into the issue of elder abuse, the book kind of breaks things down a little bit, and giving us 5 different types of abuse that we may see that's taking place with our elderly. Again, we have to just be mindful to keep our eyes open, our ears open when we are working with clients, consumers, and patients, and be knowledgeable of possible signs of abuse. So we have physical abuse, sexual abuse, psychological abuse, financial abuse, and neglect. And I think that it's safe to say that we have, over time, and through our mass media, we have seen news stories and have seen accounts. We have seen investigative reporting in regards to elder abuse, and how it impacts that specific population. When we think about the impact that it has on that population, we have to know that excuse me, um, we have to know that when we're looking at that specific population, that there is some very specific work that we, the helping professional, that we are responsible, that we have to provide, not just for the aging population, but for the caregivers and for society as a whole, to be mindful of. These are some of the things to look for, some of the things to be mindful of, some of the things we have to gain an understanding in order to prevent elder abuse. When we talk about the services that we provide, similar with what we do with child abuse, we look at advocacy, we look at protective services. How are we providing, or what agencies or organizations are in our area that provide protective services for elder abuse? Public education, again, this public health issue. How are we informing the public? How is our curriculum set up for training, professional trainings or professional continuing education for our professionals that may be working with the gerontological population or gerontological social work? What are we looking at for support groups for our caregivers, resources for them? How are we preparing folks to be successful in caring for our aging population? So elder abuse is a very big thing, y'all, and we just have to kind of be mindful that when we're talking about elder abuse, as I stated before, it's similar to child abuse because we're looking at a population whose voice is sometimes muffled, sometimes we don't hear it, and we have to work extra hard to make sure that we provide protection for that population. Now, I'm going through this last part fairly quickly, only because there's some very specific information that I want to get to when we talk about services for our aging population. And one of the specific services that we look at is going to be case management. Now, when we talk about case management for our growing aging population, there are some very specific things that we have to be mindful of, resources that for us, for the younger generation, that kind of come automatic, things that we think about, or I should say, things that we do that we don't give a second thought to. But these are issues and resources and services that are provided to our growing aging population. Not that they forget about them, but it just makes things a lot easier for them to kind of help to coordinate the services that they need. And so we see a lot of resources that are provided with our growing aging population, oftentimes coming from an umbrella agency or organization. We know that there are government organizations such as the Area Agency on Aging. We have local senior citizen centers, and then we have some private agencies or organizations such as Senior Life. And these umbrella agencies or organizations provide some very specific services for our growing aging population. For example, we talk about nutritional support. We have Meals on Wheels for those that are still within their home. But again, it's just providing nutritional support for our aging population. We have transportation. You don't always need to be able to drive yourself someplace. But of course, in order to have our elderly population to be safe in their transition from home to doctor's office, home to the supermarket, there's transportation that's provided. We have resources to assist with housing. We have senior activity centers and senior activities. These are resources that for you, the helping professional, that you would be knowledgeable of to make sure that when you're working with a member of the aging population who is still at home, then you'll be able to provide these resources. Now we have a segment of this population that may be in long-term care facilities or living in a nursing home. Your responsibility as a social worker for residents in a long-term care facility is to still provide some specific levels of care. You're going to be completing assessments. You're going to be providing information, resources to family members, as well as your client, consumer, patient that's there in the home. You're going to be providing case management services. Again, still kind of looking at how we're planning these visits. A doctor's visit if you're leaving outside of the nursing home, planning just community visits, things that that resident may want to do. As a social worker, you're going to be participating with the activity director and looking at the different activities that are going to be available and creating an activity plan for that resident. You're also, one of your primary responsibilities as well for your client in a long-term care facility is to still be that advocate for that client that is there in a long-term care facility. So there's a lot of things that still go on that you're going to be responsible for in working with your clients that are living independently, as well as those who are living within a long-term care facility or a nursing home. Now, again, when we're talking about going in and working with our clients in a long-term care facility, I want to get to this. I went too far. I'm sorry. We'll go right here. Some of the things that we're going to be looking at is making sure that when our clients or consumers, as they continue to grow, as they continue to live and to be healthy, we want to make sure that we, as a helping professional, that their needs are still being met. Needs that are going to be exercising their physical body and exercising their mental well-being, looking at their physical health, their physical health, I'm sorry, and making sure that there is still this opportunity for socialization. One of the things that we see right now with the situation that our society or that our country is in with this pandemic, a very big concern is the feeling of isolation for our growing aging population, those that are at home as well as those that are in long-term care facilities, because there's a need to maintain social distancing. So there is a lack of interaction. So your job as a helping professional is to figure out, how do I keep the interest? How do I keep the motivation? How do I keep them engaged? So there is a lot that goes into providing services, again, for our growing aging population during this time of the pandemic. Some of the other things that we see with our aging population is an increase in volunteerism. We see the senior centers, and those senior citizen centers have a lot of activities for our growing aging population. We see living communities that are, those 50 and above or 50 and older type of living communities where it's very limited to who is going to be living there, of course, by their age, but also it fosters a sense of community. It gives you that opportunity to socialize with people that you feel that you are like-minded with. When we get down to the nuts and bolts of it all, looking at things from our governing perspective from the NASW, the NASW gives us very specific information in how we address the well-being, the safety, the health of our growing aging population. So that is our again, our governing board, the NASW, and them giving us some very specific guidelines and making sure that when we're talking with our growing aging population, and when we're working with them, I should say, that we are providing the services that most definitely are going to be advantageous for them, and that are going to also provide them with the resources, with the outcome that we are hopeful that they will receive. And that's going to be, again, just empowering that community. All right, good people. So when we're talking about working with adults and our aging population, we have issues of bereavement, grief, death and dying. We have issues of safety. We have issues of, again, growing a little bit older, and we have our aging population and some of the issues that they deal with. As I stated before, I'm going to have this extra video in this week's folder. Again, it's entitled Grandpa, Do You Know Who I Am? And again, I just want you to watch this not as entertainment, but I want you to watch it as if you are a helping professional and you're assessing some of the needs that you may see in place for, again, the aging population, that person that has been identified as being diagnosed with Alzheimer's or dementia, as well as the caregivers. We got to be mindful that the support system for the caregivers is very important when we're talking about working with and providing services for our growing aging population. All right, good people. So in this week's folder, like I stated, there will be another video, there will be a chapter exam, and your discussion post. All right, so if you have any questions, comments, or concerns, feel free to contact me, excuse me, by email or on my office phone. All right, everybody have a blessed day, and we'll talk to you soon.